Welcome to the Perimenopause Portal. I'm Allison Lorne, navigating challenges and cultivating meaning. My mission statement is to lead a paradigm shift in perimenopause, beyond symptom-based management and towards honoring this transition as an initiation into feminine power, purpose, and embodied wisdom. I'm a certified nurse midwife and registered nurse. I have 25 years of experience in women's health, and I've created a private practice that blends evidence-based modern medicine, labs, diagnoses, prescriptions, with somatic processing, right? How do we experience emotions in the body, and intuitive energy work. I've created a holistic approach to healthcare that is really unique and niche. I guide women through modern rites of passage to develop intuitive clarity so they can confidently self-advocate in their healthcare, relationships, and personal development. Today, I hope that you walk away with an understanding of the basic physiology of perimenopause, with the biggest challenges most women face. We'll start building emotional capacity with somatic practice. Identify messages that aren't supporting you on your journey and how to calibrate to your own truth, as well as create more spiritually uplifting and meaningful rite of passage. Are you ready for an adventure? Today you've answered the call by watching the webinar, and the conversation's just beginning. I offer coaching programs, one-to-one work, and I would love to hear from you. All the information for contacting me is going to be in the description of the video. Decorum of the forum. References to female anatomy, women's health, or gender-specific language are not meant to be exclusive. Introduce yourself to your body. Let's just take a couple seconds here to drop in, right? Find your breath and connect to the body, and just notice the attitude you have towards the material today, right? You coming in, to this space here of study, of learning. What is it that is registering for you energetically? Is it curiosity, a little trepidation perhaps, any anxiety in relationship to the subject matter? Are you already bored? Do you have worry about it? Are you excited to learn? Is it curiosity? What is it that you feel in your body? Can you tap in and track that, identify where that is, and just put a couple of breaths there, observing and noticing your own process. Perhaps a hand on the heart and a hand on the womb, connecting these energy centers and communicating that showing up today is an act of self-care, that engaging with this material is an act of self-love. Connecting the heart and the womb, building out love and capacity in the body for the feminine experience of perimenopause. In doing this, we're opening that line of communication with the body. We're letting the body know we're here to listen. And this is one of the first steps in becoming somatically aware. What is the perimenopause portal? A portal is a passage, a threshold of transformation. It's not a distinct moment in time, but it's a continuum. We're missing ceremonial rites in passage in our modern society. We have baby showers for pregnancy and new motherhood. We even have sex ed for adolescents, but we don't really have a cohesive passage of education and experience and honor that elevates perimenopause. If anything, it's just a lot of negative messaging. I created the portal to help remedy just that. Let's not pathologize perimenopause. When you hear that dominant paradigm narrative that is negative messaging around what your body will naturally, eventually be experiencing, I invite you to question it. Is it worthwhile for you to listen to that information? Is there a deeper truth available that feels more supportive? Let's talk about what perimenopause really is. What's actually happening is that it's a normal physiological event. Your ovaries are retiring and they deserve to retire. They've been working really hard all your childbearing years, pushing out egg after egg after egg, and they've been keeping a schedule for the body. This cyclical living has been driving your emotions and multiple physiological symptoms. The ovaries finally get to step back from that primary role of managing the body in that cyclical living, and it's asking us to step in to a deeper level of wisdom and awareness with natural cycles. We see declining progesterone, declining estrogen, and declining testosterone. And I have an orca here because orcas are one of the few mammals that we have been able to document that experience menopause. The grandmother hypothesis speaks to the value of the menopausal matriarch. So orcas, narwhals, pilot whales, and other toothed whales, we do have documentation that these matriarchs, these are matriarchal societies, and these elder matriarchs, these grandmothers, have this incredible ancestral knowledge of hunting grounds that's been passed down for generations. And over their lifespan, they've been able to accumulate knowledge about the health and viability of these hunting grounds. They know how to lead their community into these hunting grounds. So the transmission of wisdom that the elder matriarch is capable of is highly valued. When we see these typically large mammals go through menopause, it's theorized that it is this post-reproductive female that significantly increases their own genetic legacy by investing energy in raising grandchildren rather than having more children of their own. When we look to nature, we find meaning. When we look to nature, we can find understanding and purpose. How can you apply that to your own understanding of perimenopause and menopause as being a valued stage in a woman's life? This is just a short graph showing you the continuum of menopause transition. Excuse me. So we see women in premenopause in their childbearing years approaching perimenopause, which can begin early in your late 30s and go through the 40s and into your early 50s. Then we see menopause, the average age of menopause at 55, give or take 10 years. So we have this range from 45 to 65 that is when menopause actually can occur, which is defined as a year without periods. And then we see perimenopause can last over 10 years. So, right, the early range might be 35 years old that you start seeing symptoms of perimenopause. Some people go through perimenopause quickly. Some people have a more drawn out experience. Everybody's different. And it's just the same as adolescence, just in reverse. In adolescence, we're seeing the onset of estrogen and progesterone that starts coming in like a storm, like it's like a Richter scale. And then in perimenopause, we start seeing that Richter scale again and the decline of these hormones, estrogen, progesterone, and testosterone. Progesterone's the first hormone that starts declining, followed by estrogen. And progesterone is that hormone that gives us that rest and nurturing feeling. It's the predominant hormone in pregnancy. So it helps reduce anxiety and it helps increase our sleep quality. That's why some of the earliest signs of perimenopause are mood disturbance and sleep disturbance. Why it feels so hard. We often see anxiety, irritability, rage, exhaustion, sleep disturbance, and attention deficit starting to come forward in the perimenopause period. Your old identity is cracking open. The psyche is being reborn through hormonal metamorphosis for the last time. We see this hormonal metamorphosis occur in 3 times over a woman's life. In adolescence, the brain is bathed in hormones, and we see that identity shift, which is really based on our relationship to others. Peer groups are incredibly important in adolescence. We're really like externally focused, trying to discover ourselves and relationships to other. Uh, in motherhood, again, we're seeing that hormonal bath of the brain, the hormone of pregnancy, primarily progesterone, and then we're seeing a precipitous drop in progesterone in the postpartum period. And that shift creates a real identity crisis, a role definition, a psyche being reborn into motherhood, the focus being on the newborn. And in perimenopause, we start seeing that psychic bath of hormones again in the brain, being a rebirth of the psyche, a rebirth of identity. And at this time, the focus is on yourself. You finally get to take inventory of what really matters to you, how you want to show up, what your legacy is, how you want to drive this experience in this chapter of your life. This is when we start having less fucks to give about what other people think, and we're more focused on what really matters to us. Reclaiming the narrative around perimenopause is acknowledging perimenopause as a sacred transformation. When we do this, it elevates the experience and gives it more meaning. Instead of trying to mute our feelings, we can work to increase capacity for uncomfortable emotions. The benefit is less reactivity and increased space for your true self to come forward. When we see this transition as an initiation into our authenticity and authority, we can experience perimenopause as an awakening to our personal power. The modern setup is that without this paradigm shift, you're just trying to carry on with all your roles and responsibilities while you're walking around like a pinball, bumping into everything and trying to just avoid getting triggered by every little thing. Things feel like they're fraying at the edges, coming apart at the seams. The old coping mechanisms don't support you anymore. Relationships suffer. Life keeps getting more difficult, and it feels like the new normal is just a near constant state of hopelessness. The body always has the last word. That's a Brene Brown quote that I just love. How soon you start listening is up to you. The body is always in the present moment. The body is always trying to speak to you, and the body will continue to get louder until you really are listening. And this is how the symptoms of perimenopause are really showing us through the body that it's time to wake up and listen. Here I'm introducing the pillars of the portal: somatic practice, hormonal balance, and spiritual perspective. You'll see these throughout the slides. My story is embarrassing. It's embarrassing to admit that I'm a certified nurse midwife with over 25 years experience, and I didn't realize I was in perimenopause. I first saw the early signs in my 30s, but I just didn't realize that's what it was. I started waking up in the middle of the night with night terrors. I would wake up and sit bolt upright screaming. I had a history of traumatic childhood experiences, sexual abuse. I had been in talk therapy since I was a teenager, but none of it was really getting me through the growing level of anxiety that was starting to take over. My coping mechanisms were really not well-rounded. I started to become more dependent on alcohol. I became more externally focused, going out and dancing and playing really hard, trying to blow off steam. I was working nights and labor and delivery, which certainly wasn't helping my sleep quality, really stressful career choices, toxic relationships. Like it was all adding up to everything starting to fall apart in my 40s. That's when my anxiety really was at its peak. And at that point, one of my superiors, my boss, the medical director at a clinic I was working at, asked if I didn't want to go on antidepressants, which full credit to antidepressants, they can save lives, but it was a wake-up call for me that I was so, excuse me, so brittle and moody, and life was so difficult that it was noticeable to others, so much so that my boss asked if I didn't want to go on antidepressants. Thankfully, at the time, my trauma informed therapist, who I'd been seeing for years, introduced me to somatics. She could see that talk therapy was only getting us so far, that I did have some avoidant tendencies, and I could talk myself out of a tight spot. I started going to see a Rosen body worker in Santa Barbara, a couple hours away, and suddenly I started finding more capacity to hold myself in uncomfortable sensation and difficult emotions, and increase that capacity to have emotional experiences coming through the body. This was life changing for me. Instead of trying to avoid my feelings, I became really interested in how to actually feel more. This is what opened me to being able to experience my spiritual gifts more deeply and have a psychic opening and a spiritual awakening at this time in my life. Hormonal balance was the missing piece. I had been treating myself for my anxiety and my sleep disturbance and my moodiness with herbs. As a trained herbalist, I had built a whole line of women's healthcare tinctures and found a lot of support with herbs and supplement and nutrition. But when I got frozen shoulder in my mid to late 40s is when I finally started hormones, and I just wish I had started them sooner. Knowing now what I know then, recognizing the signs that perimenopause was starting and that I was having progesterone decline in my late 30s, going back, had I started progesterone, I think it all would have been so much easier. Spiritually speaking, there is always greater meaning. We are really here to help walk each other home. Another quote, this is from Ram Dass. This is the sense that our own path is not just for ours alone. It's for us to alchemize our suffering into meaning and to help share that meaning with others, right? Anything that I can do to help make this easier for somebody else creates a lot of fulfillment and satisfaction. If you're watching this and you've already gotten some value, then I feel like I'm living in my purpose and I feel fulfillment. It's what drives me in doing this work. We were never meant to do this alone. We were always meant to go through these life-changing events in community. And today's society, we are missing so much of that. We're missing the teaching around creating these transitions as sacred. And looking for the spiritual perspective is finding that larger meaning. So let's do a short practice that works on healing the versions of ourselves in the past that could have benefited from a piece of information that we may have already covered in the webinar today, or something else that you can discover. Looking back in your journey so far to this point, can you find a point in time that feels like a challenge that may be illustrative of perimenopause? Is there anything that stands out to you that seems like it's been harder over the past weeks, months, years, that feels like it would fall under the umbrellas that we've discussed already because of age, hormonal transitions, that spectrum of premenopause, perimenopause, menopause? Do you have any sense of a challenge that feels like you could attribute to being due to transition? Just taking a couple of breaths here, identifying that challenge. Now, what is it that would have helped you navigate that challenge more successfully? Some sort of inner resource, a piece of information. Had you known this, had you been able to do this, had you had this perspective, fill in the blank. that would have made things easier for you. And now creating a symbol, a gift that you can hold in your hand that symbolizes that perspective. Going back in time and gifting yourself that resource. Looking at yourself in the eye as you do it and as you receive it. Perhaps putting your hands on your heart and really receiving this gift. Just a couple of breaths here. And then coming back into the moment. Seeing if you can't find a shift for how you feel about that challenge now. Understanding that working in the timeline of going back and gifting ourselves a resource helps us in the present moment. We can also work these timelines in the future and ask our future self to gift us a resource in the present moment. What are some of the obstacles that keep people stuck in the old paradigm? Old patterns of resisting big feelings. These are some quotes that I hear all the time. I'm just trying to get by. I can barely keep from blowing up at any little thing. This is speaking to that rage that we see so often in perimenopause, that phenomenon of the perimenopausal rage. I have a free somatic guided ritual on alchemizing feminine rage that I'll put in the description of this video. And I encourage you to get into finding pathways for that rage, expressing that rage through the body. It's like I don't have control over my emotions anymore. Feeling that hormonal storm, and it really causing emotional upset. I'm scared this is my new normal, that the emotional instability is going to be the new normal. Or I just want to feel like myself again. Somatic ritual is the act of coming through the body with these feelings, opening the body and letting these feelings be expressed. And in this work, we are gifting ourselves pathways of gesture, movement, posture that all help that energy move. This is a language of somatic processing that I love to teach. I find it so helpful for getting into feeling the big feelings and asking to feel more. Another obstacle, misinformation and bad advice. Menopause is natural. You don't need medications. You know what else is natural? Diabetes, cancer, heart disease, and we don't hesitate to treat any of those conditions. So looking at how much longer women are living these days, there's a lot of science out there that shows again and again, menopausal hormonal therapy will help you live longer and healthier. It's not for everybody, and some people just don't want hormones, and that's fine. The science is there to support hormonal use if you want it. Your labs are all normal, so you don't need hormones. Yes, your labs may be normal on any given day in that storming, but you can treat symptoms with hormones and with herbs and supplements for that matter. It doesn't mean that it's not time to start putting that lens on what you're experiencing and understanding that it very well could be menopause that's driving your experience. You're too young to worry about that. I hate when people tell me that they've been told this because you're never too young to worry about it. We should be taught about perimenopause early in our teenage years, or just wait for symptoms development and to develop, and then you'll treat based on that timing, that schedule. The fact is your hormones are declining before symptoms show up. I myself didn't realize I was having symptoms to perimenopause, so you might be having them and not even realize that that's what is happening. You can treat for perimenopause and menopause even if you're having uncomplicated, quick transition through perimenopause, because we know how helpful hormones are for helping you live longer and healthier. Thinking that you're meant to do this alone. There's so much emphasis on women being independent, competent, taking care of their needs. You might feel like I'm doing all the right things, or I should be able to figure this out on my own. Why didn't anybody tell me what to expect? Total lack of education in this area of our lives, and just wait for the symptoms to develop. Again, that's a repeat from the last slide, but this is really the sense that it speaks to social isolation, that you're thinking you're meant to do this alone when you were never meant to do this alone. We were always in community through our early evolution, and the social isolation, the separation from the body, the pathologizing of perimenopause, the medicalization of childbirth, of women's health, this real separation of healthcare and self-resourcing, that you go to a doctor and they tell you what you're experiencing and how you should experiencing it and what your treatments are, instead of affirming your experience, validating your sense of what's happening. I myself was dismissed the first time that I went to my provider and told her that I thought I was having frozen shoulder. I had to really advocate for myself. And unfortunately, if you're in the US, you know how broken our healthcare system is. But it is a patriarchal model that sets the provider above the patient. It's a hierarchical, it's like, I know best. And it creates this division between the patients and their own experience of their body. You are your expert in your body. You know what you're feeling better than anybody. And so it's upon us to educate ourselves and find that validation. It's why I'm so invested in doing this work and getting the message out. So, the three strategies to step into the portal today: somatic practice. We've done a little bit of this today already. Finding ways to create posture, gesture, movement in the body to get the body on board and help express that perimenopausal rage, that irritability, that brittleness, helping find more fluidity and movement, and really increasing the communication between your inner experience and outward expression. Please download the freebie in the video description, Alchemizing Feminine Rage. Super helpful in finding a way to get that energy of rage through the body. 2, hormonal balance. I invite you to identify the areas of your life that are showing imbalance. Is it sleep disturbance? Is it moodiness? Is it joint pain? Is it irregular bleeding? And what solutions are you ready for? Do you want to start hormones? Would you rather start with herbs? Do you want to target specific symptoms? Are you looking for a whole systems approach? Yeah, this is conversation that's nuanced, and we can go over that in the programs that I'll invite you to join. A spiritual perspective. What is the meaningful outcome of your personal transformation? And this is different for everybody. Why are you going through what you're going through? What can you come out of it with? And how can you use that to amplify your gifts in the world, right? You are meant to be in your power. You're meant to shine. This is that time in life when you can take inventory of what's really important to you and how you want to show up as an inspiration for others, as an example for others, but first and foremost for your own personal fulfillment. You are so worth it. Navigating perimenopause experience with the right support can make all the difference between spending years of suffering bouncing between providers and who will take your symptoms seriously and validate you, and coaching with somebody that's really focused on your empowerment and your expansion and your growth. Finding increased emotional capacity, formulating treatment plans that are really personal and specific, and connecting you to a deeper sense of meaning in your experience. If you're ready to jump into the portal, please visit my website, healwithallison.com/perimenopause, to learn more about joining the portal. There are two different levels of investment and participation. We have the group program with weekly calls and group calls and a bonus one-on-one appointment. And we have the personalized group program that you get the group calls as well as weekly one-on-one appointments. And there we can really go deeper and find your treatment plan that's specific to you. These programs are meant to help you find relief from your emotional symptoms, find more depth in your experience in your body, and increase your spiritual understanding of the sacred time, this profound transformation and rite of passage. Happy to open it up for questions because I'm just like curious how the presentation landed, if it brought anything up for you, if you have any questions. And you can come off mute just because there's so few of us if you want to jump in.
Hi.
Hi.
Hi. I really love the presentation. The exercise of looking at a past event was really powerful, and I really appreciate that gift, giving us that gift. I had a question for you from, I had seen a nurse practitioner group around perimenopausal symptoms. We did labs, and like she said that on the the quiz I took or whatever of my symptoms, she was like, Angie, this is like the highest I've ever seen. And she was like, this, you obviously are exhibiting a lot of, symptoms. And then we got my labs, and then labs came back, and she was like, well, your estrogen's fine. And it was like such a hit that like I just cried and cried and cried. And because it made it feel like, again, like just not being heard. I'm really sorry to be so tearful.
No, I can hear. Let's just like bring this in. I feel the throat being activated, right? So it's like, yeah, this
Not being heard.
exactly. Yeah.
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 And uh uh well they did order some progesterone for me and said, here, well, you can try this. And I could feel their like lack of confidence in guiding me through this. And that was what I took from it, was like, I don't know if they were, and I've had the bottle of progesterone in my cabinet for 2 months now, and I haven't taken it, and because I just don't have I have a lack of trust in the whole thing. And I just didn't know if you had any words of wisdom. I trust you through this. I've gained trust, and I just kind of wanted to hear what your thoughts were.
Yeah. I just
Sorry.
want to apologize. Like, I often feel like being a healthcare provider, like, you see so many gaps in care, and I
Hmm.
just feel sorry for
I
anybody
know.
that gets those messages, right?
Hmm.
That first that you're not the expert,
Hmm.
right? You know what you're experiencing. You
Yeah.
came in requesting support and requesting help, right?
Hmm.
And not only, yeah, are you not met, but then it almost feels like the undercutting of saying the labs are normal. I've heard this so often, uh, just that, yeah, the hormone levels are normal, as if like you don't need to attend to the symptoms.
Yeah.
Right, just because the labs are normal doesn't mean you're still not struggling.
Right.
Right. So just to validate that the struggle is real,
Hmm.
yeah, let's just start with that.
Hmm.
Perimenopause is that continuum, it's that spectrum of symptoms, and the labs in any given day are different.
Yeah.
So,
That was my kind of thought was, isn't it the storming and norming that happens? Is the whole process so like, did we get it on a day? Did you draw my blood at a single point in time where my ovaries were working just fine that day?
yeah, exactly. Yeah, you're exactly right. So what we do know is that the trend in perimenopause is a decline, and that we
Hmm.
see progesterone declining first. So that
Hmm.
even if it's like within normal on any given day, next week it could be really low and you could be storming. It doesn't preclude starting hormones.
Hmm.
So we don't I don't draw labs to determine when to start hormones.
Hmm.
I am a fan of hormones. I'll just say that hormones can be really helpful. Starting progesterone in your 30s can be a great idea, especially if you're symptomatic, but not even if you're symptomatic. You can start progesterone because we know that it's declining.
Hmm.
And progesterone is the nest and rest hormone. It
Hmm.
gives us that sleep. It gives us
Hmm.
the nervous system regulation. It gives us that softening. It gives us that extra cushion so that things don't feel so brittle and hard.
Hmm.
Progesterone is that hormone in pregnancy. So we see the roundness, the nurturing, right? We see
Hmm.
that settling in that happens in pregnancy. So progesterone in and of itself is great to start. You
Hmm.
have the prescription, you
Hmm.
have the bottle,
Hmm.
and you're not starting it because you didn't trust the recommendations and advice of this provider that felt like they were giving you mixed signals.
Yeah, it was felt like if they're just kind of throwing it at me without, I mean, they did a great job of giving pamphlets and things to read and said, here, take this and we'll talk about it in a month and see. Um, I, but I didn't feel like I heard enough of a well-rounded like explanation of what my symptoms were to be able to trust that that was even the right hormone treatment for me. Does that
Hmm.
make sense?
Yeah. Do you want to share? Do you want to share more?
Um, I expected as a nurse, I expected more education about my body and what I was going through.
Hmm.
And not receiving that made me automatically, they wrote me a prescription. I did fill it, but I also just it was I knew instantly that like they weren't my people.
Hmm. Hmm.
Yeah.
I love my progesterone even more than my estrogen. Like if I get in bed and I forgot to take it, I like get back out of bed and go take it. Like I'm like sometimes you get totally tucked in and you're like, "Oh gosh." It's worth it because it helps me sleep so much better.
Mm,
Um
that might be beneficial to my life.
yeah. Yeah.
Hmm.
Like of course you can like I'm a huge fan of herbs and other sleep hygiene
Hmm.
approaches like screen
Yeah.
time and all the things that you know of already. But progesterone, we don't see any risks of taking progesterone. Estrogen has that slight risk of increased blood clots.
Hmm.
The dose, you could start at 100.
That's what they
Imagine.
started.
Yeah.
Hmm.
So that's the lower dose. And you can just try it and see how you feel, right?
Yeah.
And give it, I would say give it at least 3 months.
Mhm. I've read your email that said 3 months.
Okay. Yeah. Because
Yeah.
there is sometimes that like couple weeks of like, sometimes it makes you feel uh overly tired. Like you're used to being without it. You're used to being like grinding and then
Hmm.
you're giving this warm blanket and sometimes you're just like, "Oh, there's a mismatch of how I was expecting to feel and how the
Hmm.
progesterone's making me feel." So giving yourself a little bit of time to adjust.
Okay.
At least a couple weeks, but 3 months is like when we start any hormonal birth control, anything. Usually we're like start a medication and then 3 months later is that great interval, even
Hmm.
cholesterol statins or something like that, right? You're like
Yeah.
3 months is a good amount of time to give your body a chance to see if it's acclimated.
Okay.
But don't be surprised if you feel a little overly tired in
Okay.
those first couple weeks. I woke up with like puffy eyes for the first couple of
Hmm.
weeks. So you might take
It's giving first trimester, by the way.
totally. Totally. Yeah, exactly. Exactly.
Yeah.
Yes. And so overall, I think when you get through that, you're like, oh, I feel so much better. But
Okay.
at first, there's like that sort of adjustment period.
Okay.
So you might take it sooner in the day, like at 4 p.m. instead of 10 p.m.,
Mm.
so that in the morning you don't feel as slow to wake up, honestly.
Okay.
Yeah.
Okay. Thanks. I really appreciate you talking me through that.
My pleasure. Yeah, I'm so glad you're here. Anything else coming up for anybody? Maggie said, I feel like I can blame everything weird on perimenopause, but I also have an IUD, so I just feel confused at them, uncertain where to go with it all. Yeah, IUDs are awesome. I'm assuming you have a progesterone IUD. And the reason we use progesterone in hormone therapy is to reduce the risk of endometrial cancer when people are taking estrogen. So when you have the hormonal IUD, you'll often get the recommendation that you don't need to take progesterone, which I personally don't agree with. You're not getting the systemic progesterone with the benefits of feeling softer and more supported and getting better sleep and having less anxiety. So, women in their 30s with anxiety, depression, sleep disturbance will often go to a primary care provider and get antidepressants when really it's progesterone decline. So with the progesterone IUD, you'll often be told, oh, you have the progesterone on board, you don't need it. But you can certainly request to take systemic oral micronized progesterone for those other benefits that the IUD does not provide when it's just being locally delivered in the uterus. I hope that makes sense, Maggie. Yeah. And oh, good. Great. Yeah. Very helpful insights. Thanks. It's not a magic wand. Everything is not perimenopause. And menopause treatment, perimenopause treatment is not a magic wand for your whole life. Which is why in the portal, in this holistic approach of the somatics and the spiritual and the physical, right? Mind, body, spirit, we're talking about a whole approach to helping you find more balance and more meaning in this transition. There's no one silver bullet that is gonna make everything wonderful. That is the journey of our lives, right? Is like finding our way through. That's what makes it meaningful. That's what makes it rich. That's where we find our own purpose. So as much as like the list of symptoms in menopause could be like 70 symptoms long, it goes on and on and on. It is like a complete reformation. It's a complete rebranding of the identity and the personality and the psyche. There's more to it. It like you get out of it what you put into it. If you come into perimenopause with the attitude like I am going to use this as an opportunity to up level, to make the most out of where I want to go and how I want to steer my ship in the coming years, it's an incredible opportunity to find purpose and meaning.